Lakeland Currents, your public affairs program for north central Minnesota. Production funding for Lakeland Currents is made possible by Bemidji Regional Airport, serving the region with daily flights to Minneapolis-St. Paul International Airport. More information available at bemidjiairport.org. Closed captioning for Lakeland Currents is sponsored by Nisswa Tax Service, tax preparation for businesses and individuals. Online at nisswatax.com.
Hello again. I'm Jason Edens, your host of Lakeland Currents. Thank you for joining us again, and thanks for your continued support of Lakeland Public TV. Friends, few people have been left untouched by the pandemic. There are no shortages of challenges that we're all facing. However, one of the lesser known challenges faced by many Americans is around mental health issues. The pandemic is a powerful reminder that mental health and human health are inseparable. Here to help us better understand the unique mental health challenges many of us are facing and some of the resources that are available is founder and executive director of Wellness in the Woods and Minnesota Rural Health Hero, Jody Freiholz-London. Jody, thank you so much for joining us, and thank you for the important work you do.
Thank you very much. I am humbled and honored to be part of offering whatever information we can today, and you are absolutely correct. There are individuals across Minnesota who are really struggling with new emotions and feelings that they have never had before. That is absolutely true.
Yeah. Well, before we learn a little bit more about that, I guess I'd like to learn just a little bit about Wellness in the Woods and your status as a Minnesota Rural Health Hero. So can you tell us a little bit about the origin story of your organization and your status as a rural health hero?
Sure, absolutely. I've always lived in Todd County, Minnesota. I'll just tell you, I'm almost 62 years old. I have 32 grandkids spread all over the place. We just had a brand new one who I haven't seen in person yet. And I've always had a real heart for rural Minnesota and our unique and special needs in rural Minnesota. So my work as a social justice, kind of a social instigator person, probably began when I was very small. My dad was a dairy farmer, and when the price of milk was low, this was a long time ago because I was about 5. There was a protest around the low price of milk, and he put a little sign on me and put me in front of a TV camera. So at 5, I was already protesting something. And I think that really looking at the work that I did in my rural community in Minnesota started in serving people in long-term care and then helping people find jobs. And many of the individuals that I helped had mental health challenges. That really didn't touch me personally until 2005 when I went through some of my own challenges. And suddenly I became the person not providing support to others, but needing that support. That was a real change in perception. But it also moved me into a place of advocacy and some really insightful pieces about my own challenges, but the number of people in Minnesota who also have challenges, and across the globe for that matter. And originally, I started working with Minnesota's mental health consumer organization based out of St. Paul. And when they started struggling, I created Wellness in the Woods in 2013.
Jody, I'm afraid I can't hear you at the moment.
Okay.
Oh, there we go. You're back.
I'm back. Wonderful. So we started an organization, a nonprofit in 2013 without really a clue other than we wanted it totally run by people who had a lived experience. So all of our board members and all of our staff identify as having that lived experience. That's really important to us. How that kind of moved forward is that we built relationships with people and got some funding through a federal program and now run a number of funded programs throughout Minnesota and have went from a staff of 1, me, to a staff of 40 people and 8 board members.
So would you say that one of the things that makes Wellness in the Woods particularly unique in the mental health care provider space is the fact that both your staff and your leadership have had a lived experience? Is that Would you describe that as unique in the mental health care provider space?
Absolutely, absolutely it is, and we really maintain that status because we think it's so important that those of us who've had that lived experience
Hmm.
can best empathize with other individuals who are going through that same kind of challenge right now. And we know that at some point in time, 50% of us will have some kind of an emotional challenge in our lifetime, be it short or long term. So that is key. That peer perspective is really key to the services we provide.
I would have thought that that peer perspective, as you say, would have been more common and maybe even more intuitive to the industry, for lack of a better term. But it sounds as if this is pioneering.
That's very true. As a matter of fact, in the state of Minnesota, it only became a billable kind of service in 2009, so that individuals who go through a 2-week training to become certified peer specialists can work with a medical model professional, mental health professional, and can bill those services. Unfortunately, that has not been embraced, particularly by the medical model. There is still leaning towards medication, therapy, whatever those things look like, and not that that's a bad thing because that's part of my wellness, regime as well, but
Sure.
we do know that connecting with other people who have the same kind of experiences is absolutely imperative. As I'm watching the social media groups who are just starting to support each other, and whether it's just venting or talking about how they're feeling, that connection is absolutely key.
Hmm. Well, as a mental health professional, we were very excited to speak with you so we could better understand some of the mental health challenges that people are facing today that are unique to the pandemic. So I'd
Mhm.
like to start our conversation around the grieving process. One of the things that I've been thinking about a great deal is that all of us, in some way, shape, or form, are going through the grieving process. We may have lost the opportunity to have a conventional high school graduation or a conventional commencement, or perhaps we've lost a loved one as a result of the pandemic, or perhaps it's an acute economic challenge. Whatever the case might be, many of us are going through the grieving process as we lose various things and move into a new normal. Can you tell us a little bit about the grieving process and what people should expect as they wrestle with it, frankly?
Absolutely, no question, and I think you hit on a real important topic that, yes, we are grieving. When we usually think of the grieving process, we think of a loss through death, but any kind of a loss
Mhm.
promotes that sense of grieving, and so there are some usual slash normal slash expected results from grieving. And there are phases of that grieving process. Oftentimes that has to do with anger. Why is this happening to me? Why should this be happening? We look for who's responsible for this happening.
Mm.
Sometimes that anger is directed at leadership or innocent victims or a higher power, whatever that looks like. So there's the why did this happen, that anger piece. And then we move into a phase where we actually start thinking about, okay, what next? And we still don't have a lot of answers to what next.
Mhm.
Think the unknown piece about when can I go back to work? What's it going to look like in the future? How am I going to pay my rent? All of those financial unknowns are causing a great deal of anxiety. The not being able to spend time with whoever my support network is, be it my friends, my family, my colleagues, is creating a sense of isolation. And I've heard people just say, "I just wanna go out and have coffee with my
Yeah,
friends. I just
sure.
wanna go out and have dinner with my friends." So that human connection and that loss, we
Mhm.
think of that as being a loss, but that's really coming forward in this particular time. Some of the other loss pieces and grief pieces are, what's my life gonna look like when we go back to whatever normal is?
Right.
That going to be different? And certainly as we as an agency have moved to more virtual support systems, which we've certainly done, that's going to look different in how our future relationships are looking. So
Mhm.
as we look at funding streams, and we were fortunate that we were many of our services were offered virtually, like our warm line already was done, but many of the in-person trainings we have made to have made those adjustments to do those virtually, and that's a huge change. Even as our staff and board used to just get together and celebrate, it's hard to celebrate
Sure.
anything virtually. So
Yeah.
celebrations that you mentioned, not being able to go to a graduation and have a
Right.
graduation party, and those pieces are all very real. And so that anger, that acceptance of this is the way it's going to be, but also the unknown of what's it going to look like in the future.
Yeah, that's a really interesting point, Jody, because it's almost as if we're grieving something that we don't fully understand yet. In other words, we don't necessarily know what we're losing because we
Yeah,
don't know what the new normal is going to be like, and yet we're still grieving it. So it's a really perplexing
absolutely.
matter. Well,
Absolutely.
you, as a provider, I'm really interested if you've seen maybe an uptick in the need for mental health services. Are you seeing or hearing about, because of course you're a part of the community, are you learning that more and more people are in need of mental health services as we struggle with these?
We absolutely are. One of the pieces that's a real struggle that we're hearing about is the increased overdoses with folks who are struggling with addiction challenges.
Hmm.
And I wasn't even aware and didn't even have the perception, but one of our staff also has another job and works in a homeless shelter. And he's talking about the number of individuals there who struggle with mental health and addiction challenges. And suddenly they receive a stimulus check and they're already struggling. And their coping mechanism is using substances. And so here's $1,200 and they're going to use whatever coping mechanism is comfortable for them. And unfortunately, if it's substances, that can lead to an additional overdose. So there's a lot of concern about that. Plus, the other piece that we're aware of is that first responders aren't able to access and support them in a manner that they really need to be supported. So that's a piece that we're seeing. We're also seeing that seniors in particular are much more isolated. And so when I think back to when I look at my mom, for example, or when I look at seniors in congregate living who got together for bingo and coffee
Hmm.
in the afternoon and meals, they're
Hmm.
staying in their rooms. So they're, even though they're in congregate living, they are feeling isolated and depressed and just can't reach out to a support network that they're used to. The same kind of thing with colleagues who are used to getting together and supporting each other in can be anything from my baby's first tooth to a struggle that I'm having with finances. We're just not able to connect with people. So we're seeing that. We're also seeing individuals who are part of our virtual peer support network talking about what a lifeline it's been to just have someone who can say, "You're not alone with these feelings.
Hmm.
What you're feeling is pretty common right now. So
Hmm.
know that you're not the odd man out, but that really and truly this is a pretty common feeling."
Sure. Well, your example of overdose is a very eye-opening unintended consequence. Just a little bit more about the grieving process. Isn't denial sometimes a part of the grieving process? And how are you seeing that play out? I hear a lot of very optimistic comments about the fact that this will pass soon. And sometimes I wonder if that isn't yet another manifestation of the grieving process, right? We're all optimistic that this will pass. But there's another part of me that wonders if that's not potentially a form of denial.
Absolutely, I think it is. And I think one of the important pieces that we as peers and as staff from Wellness in the Woods, we have to hold on to hope. One of our key recovery concepts is that we have to know it's going to get better.
Yeah.
So being able to hold on to that, and it certainly might be a part of the denial, but if we lose that sense of hope that it's going to get better,
Mm-hmm.
it leads us into a very dangerous place.
Mm-hmm.
And
Mm-hmm.
for those of us who've been in that place where we have lost hope,
Mm-hmm.
bringing people around us who can hold on to even a flicker of it is really, really important. So when I talk to folks about how we can support each other, it really is about validating your worth, your importance. We are in this together, really building that sense of connection that we're here for each other. And sometimes that means something as simple as finding somebody who has masks to donate and getting them what they need to be. I know that the work that we've been doing, we're doing a lot of work supporting the Postal Service right now because I'm mailing all of my training material that I
Mm.
used to be able to just hand out to people at training. So even though it might be a sense of denial in what's happening, I think it's really important that we hang on to that hope that, yes, we are going to get through this together.
Well, that's great, encouraging guidance. I appreciate that. You know,
Absolutely.
you've already mentioned this a little bit, but I want to explore it a little bit further, and that's the intimacy that some of us have lost. I, like many, haven't had the opportunity to visit with my parents, for example, in close
Mhm.
proximity out of safety concerns. And I
Sure.
recently read an article about how the World Health Organization is actually going to be issuing guidance about when grandkids can hug their grandparents, for example. And I'm wondering if you can speak to the impact on the human psyche and our mental health when we lack that connection with our loved ones, be they friends or family.
Well, there's the old saying about no man is an island, no human is an island.
Mhm.
Even introverts, I'm married to an introvert, and he's really he really number one, he really likes me being home all the time because I travel a lot.
Mhm.
Secondly, there is this internal human need for connection, and what I have seen is that there are people who are saying, "I don't care what the guidelines are, I need a hug."
Mhm.
Of course, there are a number of opinions about social distancing and all of those pieces, and I think we have to take all of those things into consideration. I think there's some really great guidelines that have been set apart. That doesn't mean that I'm not going to hug my grandchildren, but it does mean that when I go out into the community, I'm gonna wear a mask, not just for my protection, but those people who are around me.
Right.
And when I go and see my new grandchild, that I'm gonna wear a mask because he's 6 days old and because I want him to be healthy. But I am really missing those hugs from grandkids right now, and so I have to take into consideration, and I think we all do, what is true, what is factual, what are those recommendations that work in our community, and how is that different in New York City than it is in Todd County, Minnesota?
Mhm.
I think some of the struggle here is really that people are trying to figure out what's true, what's honest, and what applies to them.
That makes sense. Yeah, your comment about Todd County is really interesting because, of course, here in rural Minnesota, to date, we haven't seen a high rate of infection, and the peak certainly hasn't arrived in our communities just yet. But elsewhere in the country, people are losing loved ones. And one of the things I wanted to hopefully learn from you is if you have any guidance for those folks who haven't been able to visit their loved ones in the hospital or haven't been able to attend a funeral with their friends and family when someone has passed. That's
Mhm.
obviously a very difficult time for people. And I'm wondering if you have any guidance for those folks who may not be able to visit their mother, their partner in the hospital. Can you speak to that?
No question. That's something that has just I know the word unprecedented has been happening a lot. This
Hmm.
really is unprecedented that we haven't been able to visit with people that we care about, to attend funerals when we need to. Fortunately, we're looking at a number of organizations who have moved virtually into offering support for people like that, and it's really important that we stay connected, that we are able to express those emotions fully, whether it's anger or crying or whatever that looks like, but staying connected some way or another. However that looks virtually right now is gonna be really important because that grieving process with that intensity of loss
Hmm.
is certainly a process that we don't want to handle alone. I can't even imagine what that would look like. When my father passed away almost 2 years ago, the real grieving process was being able to be with my siblings and have that connection, and grieve and process and stay together. So how we do that virtually is going to look different, but it's really imperative that we not hide behind whatever this sense of being okay is about,
Mhm.
because there's a great program that talks about it's okay to not be
Not
okay.
be okay.
And
Mhm.
when we're grieving like this, it's okay to cry, it's okay to be angry, it's okay to be frustrated. And as long as we're able to support each other without throwing negative comments back and forth, it gets real easy to be into that place when we're frustrated and angry. And yet being able to mutually support people wherever they are at and whatever that looks like is really key.
Well, thank you for that insight. I'm wondering, how are mental health care providers providing services? Because clearly, there's no shortage of need at this point in time. So, as a mental health care professional, what are you learning from your peers in terms of how people can use telehealth and in order to continue to provide these critical services? But on a related note, I'm also interested in accessibility. Is everyone able to take advantage of telehealth?
Well, obviously, not everybody is. This has been a real learning curve for many of us. Um, my Zoom 101 happened probably 3 weeks ago because I never used that, or WebEx or whatever folks are using to connect.
Mhm.
But do know that many organizations have moved into phone calls, or the Zoom 101 or Zoom for Idiots or whatever it's called, that short little virtual link has been utilized a great deal. And what's really interesting, I think, is that people who are doing this are saying, gee, that's not as difficult as I thought it was.
Yeah.
That's good. But then again, there are many individuals who don't have access to Wi-Fi or don't have a smartphone, or so I see that there are professionals who are making one-on-one calls through a landline or a telephone and staying connected that way. Our warm line that we run from 5 at night till 9 in the morning is only a phone call away. So we have that available 7 days a week, and people can call and talk about anything they want to. It's not about crisis. We have a lot of people who are obviously calling who are lonely and feeling isolated and just want to know that they're not there and alone. But that virtual piece, a virtual support kind of network, looks much different than in person, but I'm also really surprised at how well participants are really evolving into making a new connection, a new family, and a new group virtually that used to be in person. So
Right.
the transition is going better than we expected.
Well, we only have a couple minutes left, but I still have a couple questions for you, Jody. So, first of all,
Mhm.
can you just tell us about the Warm Line? It's my understanding that's a statewide service, correct?
Correct. Yes, the warm line is funded by the Minnesota Department of Human Services,
Okay.
and we have trained professionals answering that every day from 5 p.m. to 9 a.m. 844-739-6369, and there are a number of people on at once. So there's not only one person, so it will roll over. We
Hmm.
also are able to have people access in different languages, up to 76 languages. So we have a in-person translator, piece of equipment that does that. So we can also offer that to other languages. And then we have a virtual peer support network every day from 10 to 4 that is also offered statewide. They can get all of that information. They don't have to remember that if you Google Wellness in the Woods, our website will come up and you can click right and log on to that information. So we bring a lot of topics statewide, and our peer specialists and our staff are all trained in offering those.
Well, that's a really practical resource that we'll make available to our viewers. So, I really appreciate that. Before we
Absolutely.
go, I want to visit a little bit about how crises often affect the powerless amongst us most gravely. So it's not uncommon for there to be inequities in the way in which society is affected. Folks that are living on the margin are already struggling with a variety of mental health issues, oftentimes. And
Absolutely.
I'm wondering if you can speak to how you're seeing that unfold right now in your community and your service territory.
Well, in Todd County, for example, where I live, which is one of the top when it's listed as counties living in poverty,
Hmm.
that's Todd County. There's no doubt about it. We have a high rate of seniors who live in Todd County, and that's not that's not unusual, but I was talking with somebody from Marshall County, which is way in northern Minnesota. That isolation and not being connected to our neighbors is a real important piece.
Hmm.
So when we think about what that looks, seniors, people living in poverty, we know there's a much higher rate of mental health challenges with people who live in poverty. Those underserved communities, the Native populations, um, the LGBTQ populations, we are absolutely doing some additional outreach to those groups. We know that as underserved groups, they are dealing with not only the new restrictions and the new pieces that come on top, but also the past traumas and the struggles that they have had. So in our community, we are seeing some really great outreaches for food distribution, and they're being utilized to the max, to the max.
That's good to hear. There are some really acute mental health issues that are being faced by frontline workers. And
Yeah.
although this may potentially be a little bit less relevant to your daily service, I'm curious if you have any guidance for those folks that either are currently or will be working on the front lines in terms of dealing with what they're seeing in hospitals and healthcare clinics. This past week, there was a very high profile example of a physician who took her own life as a
Yes.
result of what she had been experiencing, evidently from COVID. So, can you
Yes.
provide any brief guidance for frontline workers in the healthcare sector?
Well, there's some really important things that those of us who've been through some of those situations have learned. Self-care is key. Whatever that looks like, self-care and staying connected are absolutely key, because we're seeing those healthcare workers on the front line who are exhausted, who are frustrated, are overwhelmed. And those are really key pieces that impact our mental, our social, our spiritual health. So staying connected, doing what you can for self-care is going to be absolutely, absolutely key. Another piece that we are offering to individuals that we as a staff do are helping people create wellness plans for themselves.
Mm,
And one of the really key components and people we're trying to reach out to are healthcare workers. They
hmm.
can find that information about how they can virtually be part of creating their own wellness plan on our website as well. So it's kind of like a built-in insurance for what if, and we hope that we'll never use it,
Yeah.
but we want people to have a plan. What if this happens? And I'm watching healthcare workers who are living in campers and who've had to rent different apartments so they stay away from their family. And nobody would ever have predicted that this would be something that we would be dealing with. So we want them to reach out, stay connected, do what they can to take care of themselves, get enough sleep. Don't hesitate. You don't have to be brave right now. We want and understand that we might have to be vulnerable. Brene
Hmm.
Brown is a really great, she's a hero in my book, and she talks a lot about being vulnerable. Be vulnerable, ask for help, reach out. We need those folks to be okay.
Well, Jody, you certainly are a rural health hero, and I really appreciate the work that you do.
Thank you so much. It's been a pleasure visiting with you.
Thank you so much for joining us.
Absolutely. Take care.
And thank all of you for joining me. Again, I'm Jason Edens, your host of Lakeland Currents. What's currently on your mind? Send us your ideas to Lakeland Public TV. Stay strong, stay safe, be kind, and be well. See you next time.